The Cleveland Cord Blood Center is a public umbilical cord blood bank located in Cleveland, Ohio. Our mission is advancing umbilical cord blood cell therapy treatments, saving lives, enhancing health, and expanding knowledge one birth at a time. So the donations are continuing at almost a normal level. Mothers can donate as long as they haven't cared for or lived with or had close contact with someone with COVID-19, or if they themselves haven't been suspected of or diagnosed with COVID-19. There's also information that COVID-19 is not transferred from mother to baby, but there's still data out there that needs to be investigated. So during COVID-19, one thing that we've done is to limit the contact of the consenting personnel to the donor until they are really ready to donate. So we've done some interactions over the phone, and when the donor's really ready to talk with someone, then we only then have someone come in to talk with them. And the objective is to keep everyone safe and limit the contact as much as possible. We have not had a donation that has ended up coming from a donor that is COVID-19 positive. Their medical records are reviewed before the donation happens to ensure that we don't have a COVID-19 donation. One thing that Cleveland Cord Blood Centers instituted around COVID-19 is making sure that we have the containers ready to go to ship a cord blood unit at a very short notice. Those containers are ready so that we can ship with as little as 24-hour notice to a patient that needs the cells. So what makes the Cleveland Cord Blood Center unique is that we always have a container ready to go, even if we don't have a pending order or a pending shipment for a patient. We've found that it benefits us to always have one ready to go just in case we get that call for an urgent order. The most important thing is to be able to ship the cord blood cells to the patients that need them as fast as we possibly can so they can get their treatment. So overall, I would say that it has been impacted, but it's been different over time. In the beginning of the COVID-19 pandemic, in March and April, we actually saw an increased shipment of cord blood units to patients, probably because of the fact that we could have cord blood units ready to go quickly and they could be sent immediately. And also the cord blood units that we had already stored had no risk of having COVID-19 because they were taken from donations before the COVID-19 pandemic. So cord blood, the donations have already occurred and there is no exposure for the donor relative to COVID-19. Yes, we have. So there are several of our partners that are working on COVID-19 mitigation and have approved trials for COVID-19 where they use cord blood as a source. And there's also researchers that are working on basic science research around COVID-19 that use cord blood as a source for some mitigation. Our donors have the ability to choose whether or not they would like to participate in research or just donate their cord blood to transplant. So we want to give our donors that option to choose between the two. It is not in vaccines. It is more in a therapeutic arena, and it's more about using the cord blood as an immune response for mitigating COVID-19. I think the pandemic has highlighted the ability for cord blood banks to be able to ship a cord blood unit immediately. If you're going to use an adult patient, right, I'm on the registry, and if you're not, you should be, and I got called tomorrow to be a bone marrow donor, of course I would say yes, but there's some logistics involved. You have to go get a health screening, and then you also have to schedule the time where they would harvest the cells from you, and then you need a week or two to recover. So even for me, as close to the space and as willing as I would be to donate, it might take me a week to be able to negotiate that in my schedule. With cord blood, we can send a cord blood unit that's fully tested with as little as 24 hours notice. Our staff is so committed and so dedicated, it's been remarkable to go through new schedule changes and to make sure that we're available to distribute cord blood units to patients, to get them to our research partners that need them, and everyone has changed the way that they work. The Cleveland Cord Blood Center is celebrating World Cord Blood Day in the middle of staff meeting. So we have a staff meeting scheduled in the middle of the day. We're hoping to have a few guest speakers during staff meeting, and we'll be watching the live videos and participating in World Cord Blood Day. I was also interviewed for a panel during World Cord Blood Day, and that will be shown during the day on November 17th also. Yes, I encourage everyone to watch on World Cord Blood Day. There will be information there for everyone that will explain the benefits of cord blood.